from Henry Ford Jackson Hospital Emergency Services physician, Dr. Alan Lazzara. Good morning.
Hey guys.
Good morning. How are you?
Morning. Good.
Now I know we're going to have a serious conversation, so I thought I would just start with a little bit of a light video.
A little levity.
A little levity. We're going to talk about heart attacks and heart problems, and this is my first memory of ever hearing about anything about a heart attack.
Everything okay? No problem, just having a heart attack. Almost over. Done. Very good.
You know, I remember when I was watching that as a kid thinking to myself, if I ever have a heart attack, that's what I'm going to do.
That's what you have to do.
But obviously...
Get someone else to do that.
Get someone else to do it. But it's such an important topic. People are sometimes afraid to talk about it. We're so unsure, right?
Yeah, for sure. We see, I would say the top three things that we see in the emergency department are chest pain, belly pain, and back pain.
Okay.
And so there's a lot of people that come in with chest pain because everybody knows somebody in their family or somebody, one of their neighbors or friends that has had a dad or a friend have a heart attack. And so people are afraid to talk about it. And sometimes guys are the worst. You know, guys are brought in often, their wives will make them come in, and then it's pretty serious, and the wives make them come in. So
we try to shake it off.
Yeah, like no big deal. This is going to go away. It's just heartburn, but it's a very serious topic. Yes.
So why is that, do you think, that people are afraid to come into the hospital when they're having something that might be killing them?
I mean, you've seen those billboards, right? Every year, thousands of men die of stubbornness, and I think it tends to be more of a male trait that we see. But I think people are afraid because they don't want to know that there's something wrong. I think if I ignore this thing, then it may go away. But I think that's a natural coping response, right? Denial is one of the stages of grief, I think, and that's a normal thing that people do. But we encourage people, if you're having chest pain, the first thing you need is an EKG and a triage evaluation. And so we have protocols in the department. When somebody comes in, they say, I'm having chest pain, the first thing they get is an EKG within a handful of minutes. And then those are walked back to us, and we're doing all sorts of other stuff, but I could be walking down the hallway and a technician will hand me an EKG, and if it looks abnormal, then we can activate the cath lab right away. So we're constantly, I must look at 60 or 70 EKGs a day in an 8-hour shift. So that's like 10 per hour-ish.
So that's great that you're seeing the people that are there, right? How do we get people there? What are the symptoms that we should be looking for that would require us to, hey, we need to go to the ER?
So it's different for men and women. Not that men and women have different kinds of hearts. They just have different symptoms depending on your age. It's different on age and also people's medical problems. So a typical heart attack, like Chris Farley, like you're seeing somebody who is overweight, probably smokes, he has too many steaks and too many brats, and dear to my heart because I lived in Chicago for 30 years. Those symptoms, you don't often see the big grabber where somebody grabs their chest, and it's called a Levine sign, where somebody grabs their chest and they're sweaty and they're nauseous. That's like the stereotypical thing that you learn in medical school, but we find very quickly that patients don't read the textbooks. And so typically when I see somebody who has a smoking history and they're having like persistent nausea and chest pressure, or they're sweating, those are very alarming symptoms. But women who are older, or people who have diabetes or other like chronic medical problems like that, can often have, we say atypical symptoms, but really they're typical for them. So the most common symptom for an older woman, like in her 60s or 70s, is actually fatigue or shortness of breath that's persistent. And so they don't get that same kind of like big grabbing, squeezing, chest pain or chest pressure. So we're attuned to that as well. We're trying to educate our residents as well that just because this person is nauseous doesn't mean they can't be having a coronary event as well. And there's different grades of chest pain, different things that we do. Like somebody will have an acute occlusion or a blockage in one of the coronary arteries. So coronary arteries are the arteries that feed the heart. And the coronary means crown. So imagine they're draped over the outside of the heart, and they perfuse and give the heart oxygen and blood from the outside. The heart gets oxygen from the inside as well, but when those arteries get clogged and there's like a rupture of a plaque, and then the EKG will show a certain kind of change. The electrical waves will move up or down depending on where it is. And so it can be obvious and sometimes it can be very subtle, but that's called a ST segment elevation MI, or myocardial infarction. So that's the type of person that needs to go to the cath lab right away. We're very fortunate to have wonderful interventional cardiologists at our hospital that will come to the bedside and see the patient. They answer their phone immediately. We walk the EKGs down to them if it's a case that we're not sure of, and they're doing a cath, and we're explaining the other case while they're doing another procedure. He's like, all right, that guy's next. So it's a very chop kind of operation.
More about how to know when to go to the ER, how to recognize the symptoms, and how to get the care that you need when we continue with Dr. Alan Lazzara after this. We're with Dr. Alan Lazzara, who is ER doc at Henry Ford Jackson Hospital. And you've become quite the expert and received some renown outside this area for your work on hunter safety. And again, like heart attacks that happen anywhere in just everyday life, it happens out in the field too.
Sure does.
Yeah, we have seen that where we see people who get really excited after they kill a deer, and will have that stress, or not stress, but that joy, elation, and the adrenaline rush, and then it can sometimes trigger a heart attack with your heart. It's kind of like a stress test. So patients that come in with a different kind of chest pain that don't have those obvious changes end up getting labs to look and check the blood to see if there's a protein floating around that we can pick up saying the heart's hurting. And then those patients will end up getting a stress test or an ultrasound of their heart called an echocardiogram. And those stress tests sometimes are on a treadmill, but other times they just give you a chemical that helps your heart beat fast, which is basically the same thing if you killed a big deer and your heart rate went up to 150 or 160 and you're 80 years old.
What are some early signs of poor heart health?
So I think if you think back to the stuff that your health teacher, your gym teacher told you when you were younger, that if you're not able to really exert yourself well, I think that's cardiovascular health is really multifactorial, but if you're not able to go up the stairs without being very winded, or you're certainly if you're experiencing chest pain when you're doing minimal exertion, that's not a good sign. You should talk to your regular doctor about that. But sometimes these things can really stay hidden for a long time, which is why it's hard. But we all know them, right? We all know that smoking is bad for our heart and lungs. I think in particular people don't really realize how bad it is for your heart and your blood vessels. It's really tragic when we see people who, and I feel very bad for them because it's such an addiction that they smoke for so long, and then their blood vessels get hardened in their feet and hands and legs and around the heart as well. So they have pain chronically when they walk around, but they don't advertise that kind of stuff, or you don't really learn about that. You think that, I'm going to have to be on oxygen and I won't be able to breathe, but the cardiovascular risks of smoking are tremendous. And what else? Diabetes is also these are really insidious long-term things that take their toll on your arteries. So diabetes, high blood pressure, high cholesterol, obesity, smoking, those things all together, that metabolic syndrome of the smoldering inflammation really increases your risk. So if you're already having symptoms, the ship is kind of out to sea already. If you have these other medical problems, you want to try and mitigate those or correct those, and you can do a lot of it with exercise and diet. Long term, we see people who are like, I lost this much weight and I don't need to take my high blood pressure medicine anymore. Fantastic, And it's not a ton. I have a job, I have a family, and I know how hard it is to get to the gym, and I wish I could spend an hour every day there, but I can, the most I can do is 30 minutes in my basement on a bike in front of a TV or lifting weights, and that's good enough for me right now because life is so busy. So, when people say you got to work out, we understand the difficulties of that. But even if it's we see nurses take walks around the hospital during their lunch breaks, even little things like that, small gains every day, we do these small things and they become habits, and that's what really can impact our health long term.
I feel like before COVID, we were always constantly talking about healthy workplaces and workplace initiatives to get people healthy. I haven't heard about anything like that in a while.
We had started
Do you
a
remember
walking
that?
program.
All kinds of programs
Yeah.
that were back in the day.
Yeah.
A walking program, that would be a good idea, especially right downtown.
Well, even just parking far away instead of right at the door is.
Yeah. Little things for
How
sure.
about you can measure heart function on
The
devices.
Apple Watch and stuff. So we do sometimes, we'll see people come in and they're like, my Apple Watch was saying my heart rate was 160. That generally is not the sign of a heart attack or a coronary occlusion. It's more the sign that there's a dysrhythmia or abnormal heart rate. And that can be helpful because they may not be having it when they arrive, and then we can look at that and say, okay, it was about this high, have you had symptoms like this before? And then some patients have to be admitted to the hospitals. Most patients can go home if they're not having that dysrhythmia then, and they get set up with a Holter monitor or a monitor that's more official, gets sent to the cardiologist, and then they say, oh, okay, this was the rhythm you were having.
I've been looking at that, and all I can get out of it is that I'm lying.
That you're lying,
I'm lying.
lying
And
down?
I think it's like a lie detector.
Oh,
Interesting.
it's like the up and downs of the line? Yeah, okay.
I just lied again.
I got it. Let's ask him some hard questions, should we?
I think you should maybe look into getting a different watch.
They say that, if you're not a doctor, don't look at those.
Well, there you go. And we're gosh, how lucky are we? We get to talk to Dr. Lazzara right here. All the information that we wish we could ask our doctor, right? Get
Well,
to
you
ask
should.
you.
I
It's
mean,
kinda cool.
you really should, because I think that when I go to the doctor, or, I go with my kids, that's what I really want, is the time to be able to ask questions, and that's our job, to answer questions. And we're like you came for our opinion, and this is my medical opinion after however many years of clinical practice and medical school. And so we know everybody Googles stuff. We know everybody's a lot of people are looking at their results while they're in the ED on their MyChart and stuff, but they're not really interpretable,
Right.
because you don't have the background. Just like if I brought my car in, I wouldn't know how to read the thing they plug into the engine. I don't know.
Yeah.
But I know some basics, so I'm going to ask a bunch of questions, and that's our job. So if you have questions, we're happy to answer them. And the thing that I ask when I come in the room most of the time, or try to, is, what was the thing you were most worried about? What was the thing that you needed to know today that brought you in? Because that's often in people's back of their mind. They don't ask it.
Right.
I don't know why, but they don't. So we ask.
Thanks for coming in.
Sure. Thank you for having
Thanks
me.
so much.
Dr. Alan Lazzara, Emergency Services Physician at Henry Ford Jackson Hospital. The morning show continues after this.